The patient is positioned supine with the ipsilateral hand on the abdomen. An ultrasound examination is performed in the coracoid area. A 38 mm linear probe is used for this procedure. The probe is positioned vertically with the notch towards the head end of the patient. On the screen, the blue dot side corresponds to the head end of the patient. The opposite side corresponds to the foot side of the patient. The most superficial structure on the screen is the skin, and the deepest on the screen is the chest wall area. Moving the probe vertically on a sagittal plane allows you to position the artery in the middle of the screen. The artery is seen towards the head end of the screen, or blue dot side, and the vein is seen next to it on the opposite side. A color Doppler shows the flow of blood in the vessels. Valsalva maneuver by the patient will increase the diameter of the vein. Often one may see other small vessels in the pectoral muscles. The depth is adjusted until one can see the posterior cord at about the 6 o'clock position in relation to the artery. Slight abduction of the arm often makes the structures look more defined, and the nerves often group closer to the cranial side of the artery or to the left of the screen. Superficial to the vessels, you will see two muscles. The most superficial of the two is the pectoralis major. The muscle underneath the pectoralis major is the pectoralis minor muscle. Moving the probe laterally, maintaining the sagittal orientation, will reveal the coracoid process as a hypoechoic shadow with a hyperechoic rim. If the probe is moved more medially or angled medially, one can see the edge of the chest wall and the shimmering pleura if the patient takes a deep inspiration. The probe is returned to view the vessels and structures just medial to the coracoid process. Rotation of the probe on its vertical axis will make the probe align perpendicular to the artery better. The artery should be seen as crisp, round pulsatile structure. If it looks oval or fuzzy on the edges, it signifies that the probe is not perpendicular to the artery.